In this video, I'm going to explain penicillins and some of the important points regarding penicillins. First, I will discuss the classification of penicillins, second, spectrum of activity of penicillins, and third one, some of the important pointers regarding penicillins for various competitive examinations like NEET PG examination, GPAT, NIPER, DI, NAPLEX. Okay, first classification. So penicillins can be classified into three categories. First one is the natural penicillins, second one semi-synthetic penicillins, and third one is beta-lactamase inhibitors. Natural penicillins. In this class, we have example benzyl penicillin, or penicillin G. Semi-synthetic penicillins. In semi-synthetic penicillin, it's subdivided into three categories. First category, that is acid-resistant alternate to penicillin G. Second class, penicillinase-resistant penicillins. Third one, extended spectrum penicillins. Extended spectrum penicillins are further subdivided into three categories. First one is aminopenicillins, second one is uridopenicillins, third one is carboxypenicillins. Now first, acid-resistant alternate penicillin G, that is phenoxymethylpenicillins. Other name for phenoxymethylpenicillin is penicillin V. It is acid resistant to alternative penicillin G. Second class is penicillinase resistant penicillins. The example is methicillin, cloxacillin, and dicloxacillin. Extended spectrum penicillins, they are subdivided into three categories. First one is aminopenicillin. The example under this class is ampicillin, amoxicillin, and bicampicillin. Second, uridopenicillins. The example is piperacillin and maltosillin. Third one is carboxypenicillin. The example under this clause is carbanicillin and ticarcillin. And third one is beta-lactamase inhibitors. And the example under this clause is that is clavinic acid, sulbactam, and tazobactam. Second is spectrum of activity. So penicillins are usually active against gram-positive bacteria, few gram-negative bacteria, and few anaerobes. But none of the penicillin is going to inhibit beta fragilis. So the mainly the spectrum of activity of penicillin is about gram-positive bacteria. So So the penicillin, they are going to inhibit gram-positive cocci. Example, that's streptococci, pneumococci, and gram-negative cocci. That's Neisseria gonorrhea, Neisseria meningitidis, and bacillus like bacillus anthrax and cornybacterium diphtheria. Okay, spirochetus, that's Trypanoma pallidum, and beta fragils, I told you it's a resistant. So once again, I will tell you the spectrum of activity, so that you can clearly understand it and clearly remember it. So the spectrum of activity of penicillin is that first, it is active. First point, all penicillins are bactericidal. Second point, the spectrum of activity is limited to gram-positive bacteria, few anaerobes and few gram-negative bacteria, but none of the penicillin is going to inhibit beta fragilis, that is the anaerobic bacteria. So mainly they are going to inhibit gram-positive cocci, gram-negative cocci, gram-positive bacilli, and gram-negative bacilli, and spirochetes, that is Trypanoma pallidum, which is a causative agent for syphilis. Now, one of the important point, see, one of the important point is first point, that the drug of choice for syphilis is penicillin. It's a first line drug. Penicillin is the first line drug for syphilis. Second important point is that penicillin is the natural penicillin. It's safe for pregnant women. It's the only antimicrobial agent which is safe for which is safe in case of pregnancy. Other antimicrobials some of the cephalosporin and microlides except erythromycin. So these are the safe in case of pregnancy. The third very high yield point is that is Jarish-Herxheimer's reaction. So what is Jarish-Herxheimer's reaction? See, I told you before a while that the first line drug in case of syphilis is penicillin, but in case of secondary syphilis patient, the penicillin causes Jarish-Herxheimer reaction. So what's Jarish-Herxheimer reaction? That is when a penicillin is given to secondary syphilitic patient, so it's going to cause allergic reaction, which is characterized by shivering, fever, myalgia, and exhibitions. Even vascular collapse can occur. What do you mean by secondary syphilitic patient? Secondary syphilitic patient means which is previously infected, the patient which is previously infected by syphilis and treated by penicillins. Now again, this patient is infected by syphilis. So this is called secondary syphilitic patient, which is already previously infected by syphilis. So if this patient is prescribed if this patient is prescribed penicillin, so it's going to cause Jarish-Herxheimer's reaction. So now the question comes in our mind. So what is the drug of choice in that case? So the drug of choice in secondary syphilitic patient is doxycycline. So it was all about penicillins. Hope you like this video. Please subscribe my YouTube channel and please support my YouTube channel. Give suggestions so that I can improve my YouTube channel. So and I can bring some of the more informative videos to you.